Breast cancer is one of the most common types of cancers that is affecting our women, and our men too can suffer from breast cancer. Yeah. So understanding the signs and symptoms of breast cancer, the warning signs that you can tell there is something wrong with your breast, is very important. While doing that self-breast examination, what will you be looking for? I'm Nurse Janet, and in this video here today, I want to share with you the warning signs of a breast cancer. By seeing these signs and symptoms, you are supposed to go and see your doctor. Watch to the end. Number one is new lump in your breast or your underarm. If you are doing your self-breast examination and you notice that there is a lump, it can be movable or even immovable. Regardless of the size, any lump in the breast is something to go and seek medical attention. It can be under the arm or around your armpit or just in the breast. Regardless of the size, kindly go and see your doctor, because this can be a sign of a breast tumor. The second one is nipple discharge. During pregnancy and breastfeeding, the nipple discharge can be either colostrum or even breast milk. But again, if you notice that you are not breastfeeding nor pregnant and you are experiencing nipple discharge, the discharge can be anything apart from breast milk. It can be blood, pus. Kindly go and seek medical attention, because this is not a good sign. The third one is change in the nipple. Actually, if you realize that all of a sudden your nipple is pulling inwardly, nipple inversion. For some ladies, an inverted nipple is something that is common and they live along with it. But again, if you realize all of a sudden there is that inversion that wasn't there previously and it's pulling inwardly, and it can also be painful, then actually you have to go and see a doctor, because this can be an indication that a tumor has grown inside and pulling your nipple inwards. The fourth one is thickening or swelling of any parts of the breast. It can be on the nipple or any other parts of the breast. This is also a sign that should really worry you. If you realize that there is some swollen parts of your breast and it doesn't go away with time, then you really need to go and see your doctor. Enlarged vein in your breast. Actually, during breastfeeding, some women experience engorgement of the breast, and this can lead to enlarged vein. Yeah, but again, you are not breastfeeding and all you are experiencing, you have an enlarged and prominent vein in your breast. No, this is not a good sign, and you really need to go and see a doctor. Dimpling of the skin of your breasts. Actually, just like the orange peel, you realize that the skin of your breast is getting to those small dimples, just like the orange peel. Yeah, this is not a good sign, and this is one of the most common signs of breast cancer. So if you notice any change in the skin color, texture, feeling, how it is, the appearance of the skin of your breast, then you really need to consult with your doctor. Changes in the skin of your breast, you can realize that you can be having the red, swollen, flaky, or even an itching skin, and it doesn't go out with time. Then it's not really a good sign. Any change in the skin of your breast, like it wasn't previously, and all of a sudden you realize that it's getting redder, it's getting hotter, it's inflamed, you really need to go and see a doctor, because this can be an indication of a tumor. Change in the size and the shape of the breast. Actually, breast size and shape is determined genetically, and again, they can always change depending on maybe if you are pregnant, lactating, doing some exercise, or even your weight is fluctuating. Maybe you are gaining or losing weight. But all of a sudden, if you are realizing that your breast is taking a different shape that wasn't previously, then that is not really a good sign. And again, if you realize one of your breast is outgrowing the other, maybe it's increasing in size, it keeps on increasing, then actually you really have to go and see a doctor, because this is not a good sign. It can be a sign of a tumor on the affected breast. Thank you for watching, and if you find this kind of videos helpful to you, kindly subscribe, hit the notification bell, and see you in my next video. I'll be sharing on how to do self-breast examination. Bye.